And the first principle is universality. And what that means is, if you're a human, you get it. Everybody in, nobody out. So there's really no argument about which humans should get it, because we're all humans and we all get it. And that's just it. We all are standing together saying it's a human right. We all need health care. The second principle is equity, which is a lot different than what we usually think of equity as meaning, because it doesn't mean we all get the same. And it doesn't mean that that there's an equality or a fairness involved. What it means is that each one of us gets what we need when we need it. And that really only makes sense because you're going to need something different than you're going to need. You're going to need something different than you're going to need. I need something different than you need. And particularly in the instance of health, it's really important that we get what we need, not what somebody else needs. I don't need your checkup schedule any more than you need mine. So equity of access is the second part, the first part of the second principle. The second part of the second principle, which is also equity, is equity of financing, so that people pay according to their ability. Because everybody that's human, that is a resident of Vermont, not a citizen, but a resident of Vermont, is included in this pool. And so everybody's going to pay according to their ability. The next principle is accountability. And this really goes back to our constitutional and democratic roots, because this says, yes, it is a government by the people and for the people, and the government works for us, and they need to answer for us. So we're the people, and we get to hold our legislators accountable for what they're doing or not doing. And we get to hold the health system that we're a part of accountable for whether it's meeting our needs or not. And the next principle is transparency, which is just what it sounds like. It's easy to see what our system is and how it operates. We don't have closed-door meetings. You don't need special combinations to get certain benefits. It's all very clear, and it functions that way. And the principle after that, the final one, which is really important, is participation, which is that we are the people, and we get to participate and tell our government what they need to do for us. So these principles are really hard to argue with for anybody. Because if somebody says, well, I don't think that everybody, I don't agree with universal health care. And if you say, well, so you don't think everybody should have health care? And let's say they say, no, I don't. And then you say, so which one of your neighbors or friends or relatives would you choose not to have health care? And I've never known anybody that could answer